I'm a product and engineering leader focused on patient engagement and access within healthcare. Over the last several years, I've spent a lot of time working at the intersection of contact center operations, EHR integrations, workflow automation, and AI-driven patient experience. What shaped my perspective is that I've seen both sides of technology. The innovation side, where everyone is excited about AI, and the operational side, where access teams are overwhelmed, staff is burnt out, and patients are frustrated by fragmented communications. A lot of my work today is centered around how do we go about reducing that friction in the patient journey, whether that's scheduling, billing, care coordination, inbound or outbound patient communication. Um, the key thing here, though, is keeping those experiences empathetic and operationally realistic. That's where I think our HCAF platform, which has voice AI, becomes an incredibly important feature because healthcare still very much fundamentally runs on conversation. Yeah, it's a great question. I think we're moving from voice AI being viewed as a call deflection tool to becoming an intelligent orchestration layer for patient access. Historically, healthcare organizations have implemented automation, let that be through IVRs, IVAs, conversational AI. It was primarily implemented to reduce call volumes. The problem is that the patients don't call health systems because they want to talk to a bot. They don't even enjoy talking to a bot. They call because they want to navigate uh, through something that's more complicated or stressful or some sort of an urgent situation. And that's where I think the next generation of voice AI, it has to understand not just the intent, but it has to understand the context. So what do I mean by context? I mean that, like, for example, why is the patient calling right now? What happened earlier in their journey? Did they receive some sort of a bill? Did they happen to cancel an appointment, having some sort of an issue with the referral, so on and so forth? And that's where I think the industry is heading. AI systems that understand the longitudinal patient journey instead of treating every interaction as an isolated phone call. I also think a multimodal engagement becomes critical because patients don't think in channels, right? They may start with an SMS and continue on to a voice and then receive maybe some sort of a message on a patient portal and eventually wanting to talk to a live agent. And I think the AI systems that succeed will be the ones that can maintain that continuity across all of these touch points, ultimately building that longitudinal record and building that additional patient context. And finally, I think healthcare will demand AI that augments their staff, not replaces tasks, right? And that's where I think the most successful deployments will help agents become more informed, operate faster, and be just less administratively burdened. And instead of like trying to remove the humans entirely from the experience, we want to be able to augment them and include them in this journey where, like I said, we want to make sure that they can be as informed and work faster and be able to deliver the patient experiences. I think the biggest mistake some of the organizations make when it comes to evaluating voice AI is that they might be looking at voice AI as purely a technological purchase instead of looking at it as an operationally transformative initiative. The first thing I think the health system should ask is what are the kind of problems that we're trying to solve from a patient access perspective? Because voice AI alone won't fix a broken scheduling workflow, will not fix any poor EHR data quality or fragmented departments, unclear escalation paths, so on and so forth. So it's a holistic thinking on how can we improve the outcomes and what are the problems that we're trying to solve within the patient access space. So that's number one, is to kind of think about the problems and what they're trying to solve for. The second thing is, and this is an important aspect because voice AI will only be as good as the systems that it can access in real time. So that's the integration depth of these systems. If the AI cannot reliably interact with the scheduling system or the eligibility systems or CRMs or contact center platforms, so on and so forth, the experience will break down for the patients. So that's an important thing to consider. Are we as a healthcare organization ready to be able to support the voice AI workflows? And the third thing is it's important to look at from a voice AI perspective. Again, we don't want to live in the isolation of purely voice AI. Ultimately, you'll need to see and understand if I'm purchasing and looking at software vendors that offer voice AI, do they also have the capability to be able to include a contact center agent, your staff, into the experience? Like what I mean by that is we understand not every call is going to be able to be handled by a voice AI assistant. Calls will escalate to a live human. When that call is being escalated to a live human, is the software vendor able to go ahead and provide the right context, provide the right information just in time? So when the call does route to an agent, the agent is able to carry that conversation with all the context without having to repeat any questions or ask any information that's already been submitted in the bot, right? So you have to be able to evaluate the fact that is this vendor providing me the voice AI tools, and at the same time they have capabilities that can extend voice AI capabilities into my agent's experience, so the patient experience doesn't break down. Lastly, what I would advise organizations is to think carefully about governance and trust in healthcare. AI cannot operate like any generic consumer assistant. Part of the infrastructure, there has to be transparency, escalation logic, auditability, and compliance oversight with very, very clear operational guardrails. And the organizations that will win with voice AI won't necessarily be the one with the flashiest demos, but they'll be the ones that can operationalize AI responsibly at scale. I think we're entering a phase where healthcare organizations are realizing that AI delivers the most value when it's directly embedded into their operational workflows, not when it exists as a disconnected layer sitting as an experience on top of them. The future probably isn't one massive AI system trying to do everything. It's more like an ecosystem of specialized agents working together across the patient journey, right? Helping them with scheduling, intake, billing, navigation, so on and so forth, while continuously sharing that context with one another, right? That's important. And I think that's where I think the industry is heading, towards what we built here at SpinSci. We call it HCAF, a healthcare AI framework, right? The idea is that AI in healthcare cannot operate in silos. It has to understand the patient journey, especially patient journey holistically across all of these different touch points, integrate deeply into the operational systems. That means not just an EHR integration, not just a call center integration, but we're talking about integrating all of the unstructured and structured data that lives outside of your enterprise platforms. Like it might live in your KMS on your SharePoint, or it could be living in OneDrive. How do we take all of this operational data and deeply integrate into that? And especially coordinate intelligently across all of your channels and all of your departments. What excites me the most is the opportunity to move healthcare from reactive communications to proactive engagement. Historically, patients have had to carry too much coordination themselves, repeating information, navigating disconnected systems, chasing answers across multiple departments. And AI gives us an opportunity to reduce that friction, not just for the patients, but also for the staff. And at the end of the day, the technology itself isn't part of the story, right? The real goal is creating healthcare experiences that feel connected, that feel intelligent, and most importantly, that feel empathetic, where patients feel like the system's actually understanding where they are in the journey, and it's helping them guide them forward through that healthcare journey.